morning, Sir Lim. I am Justin C. Custodio and I will be now performing a virtual demonstration on the procedure assisting the client in a sitting position. For the definition, this is a procedure in which we transfer the patient, or it is a transfer technique that enables healthcare provider to assess a patient's readiness for ambulation, reduce the risk of HAIS, and promotes comfort, circulation, respiratory function, and independence. For the objective, this first is to promote circulatory and respiratory function. Second is to prevent complication of immobility, and lastly is to prevent the risk of infection. For the safety and security measure, first is ensure that tubes and attachments are properly placed prior to the procedure to prevent accidental removal. Second is to assess clients when sitting if the patient has muscle weakness or muscle paralysis or nerve damage. And lastly is always assist the patient on their weak side. Then, for the pre-procedural preparation, first is wash your hands or perform a medical hand wash. Introduce yourself to the client, identify the client identity, explain what you are going to do, why it is necessary, and how the client can cooperate. Next is gather the necessary equipment, provide privacy, and observe proper body mechanics. So my buntag sir, kanang ako din suggested sa gusto niyo sir, yung mga student nurse from 8 a.m. to 4 p.m. Sir, so pwede ba kung makapasa yung name? Vane. Okay, Sir Vane, daw check mo kansahan. Sir, current survey, magbat na sa ato ang sitting position. Ato i-ready body sir, kay para transfer ko sa wheelchair later on, kaya ako kadalog sa mga CT scan, kaya mo as prescribed by the kanan mo doctor. So, okay na ba, sir? So, sir, makaka-cooperate tayo ka, sir, by following my instructions, sir. And, kanang needed po na siya, sir, kaya para ma-assist ka, sir. Dili, ma-reduce na to ang injury, sir, pag atong assisting sa position. Okay ba, sir? Kaya na mag-gun, sir, and dahil ay mga pamutana. So let's now head for the procedure proper. First is check for the doctor's restriction on sitting down due to medical treatment or surgical procedures. Then perform an assessment of the patient's strength and abilities. So, sir, na-check na ko yung kana chart, wala po yung si doc na restriction, and ganito po siya nga procedure, sir, kay si doc po nag-report kay para ma-transfer ka sa immune. So, I have already checked the patient's chart, and there are no contradictions in terms of this procedure. Next is lower the bed and ensure that the brakes are applied. So, assuming that I have already lowered the bed and I have already applied the brakes, next is stand facing the head of the bed at a degree angle at a 45-degree angle with your feet apart with one foot in front of the other and stand next to the waist of the patient. Then let the patient turn to the side facing you and assist the patient to move closer on the edge of the bed. Raise the bed as high as possible. Sir, makaya ba na to, sir, nga makatubag yan? Ha? Sir, balik ko today, sir. 1, 2, 3. Sir, the airport na then, assuming that the bed was raised as high as possible. Place one hand behind the patient's shoulder, supporting the neck and vertebra. Use the other hand to grasp the patient's outer stitches. Then instruct the patient to use his elbow elbow up on the bed to support, and as you support the shoulders with one hand and the other hand assisting to slide his feet off the bed, dangle or touch the floor. On the count of 3, gently raise the patient on the seated position by shifting your weight from the front foot to the back foot as the patient pushes on the bed and the nurse assisting the patient to sit on it. Make sure that your weight is on your knees and keep your back straight. Sir, sir, baliw dahil ko sa inyong elbow, sir, sa pag support, sir, while ako kan support ko, sir, na. Okay? 1, 2, 3, go. Sir, kaya ba ito, sir? Sure ba ito, sir? Then, make sure, assess that patient for orthostatic hypotension or vertigo. So, sir, during sa ato ang pagkuhan sa inyo, sir, wala na po ka nalipong, wala pa. Labad ang ulo, sir. How about, sir, ka na marag nauseous ka sa pagkuhan? Wala na po. Then, continue with mobilization procedures as required and